Thank you, Eric. What a pleasure to be with you and to see you at least through the video. And good morning, everyone. It is a pleasure to see you all here. We appreciate your attendance to this virtual event. Everything is virtual now. I would like to start by expressing my gratitude to the Ambassador, to the American Society Council of the Americas and its president, Susan Segal, for organizing this meeting, and to the Ecuadorian Minister of Public Health, Dr. Juan Carlos Zevallos, for sharing with us the public health actions taken by Ecuadorian government along these months. Even though Ecuador was one of the first countries in the world to take measures to contain this spread of COVID-19, we have experienced difficult times, suffered painful losses, and seen our economy disrupted. But the rapid and decisive actions taken by the Ecuadorian government, led by President Lenín Moreno and by Minister Zevallos, has allowed us to reduce the potential effects of this pandemic and to start reopening our economy step by step. I am honored to participate in this event with Minister Zevallos. Ecuador is very, very fortunate to have such an amazing person to count with in experience and knowledge as a specialist in epidemiology, trained in the United States Centers for Disease Control and Prevention. Dr. Zevallos has led the Ministry of Public Health of Ecuador since March 21st, and the outcomes of his decisions in the context of financial resource constraints deserve much, much praise. Without further, I give the floor to Minister Zevallos for all of us to benefit of his important remarks, and thank you so much.
With that, Minister Zevallos, we would be honored to have your intervention. Over to you. Thank you very, very much for joining us.
Eric, thank you for the presentation. I am a very humble person. I think I'm giving all my best to serve my country, and that is the most important motivation that I have, to continue working on behalf of the people of Ecuador. If you could please allow me to start the presentation. Just please confirm, Eric, that everybody's looking at the presentation.
Yes, we can see it. It looks good.
Thank you. So in the next 15 to 20 minutes, I will summarize what is the current situation of COVID-19 in Ecuador. And I have 5 objectives for this presentation. The first one is to provide you with a succinct historical summary. Second, to discuss with you some disease indicators and their tendencies and the health system impact of COVID-19. And as the third bullet, I will discuss also the epidemiological strategy and what has worked with us. And I put here as a successful pearls. And in fourth place, I would discuss the learned experiences and what are the next steps. We are dividing in a summary what happened with the COVID-19 in Ecuador in 2 periods. The first one happened in the cities of Guayaquil and Babahoyo. Those are located in the coast of Ecuador. And from there, between March 15th and March 28th, the imported cases, mainly from Spain and Italy, came and spread out as a primary and secondary transmission clusters. In the second period, there was a community transmission and an exponential growth of course, in the city of Guayaquil and in other surrounding cities that are named in the slide: San Borondón, Daule, Duran, and Milagro. And this occurred between March 29 and April 4. Also, it's very important to notice which are the contingency measures that we implemented. February 29th, it was announced as the patient 0. Nevertheless, we know now that it was actually February 15th when she arrived in Guayaquil, but it was announced officially on February 29th, and that this patient moved between the cities of Guayaquil and Babahoyo in the coast, as I said. On March 16th, it was declared the state of emergency, and the Emergency Operation Committee took place. Ecuador was the second country in Latin America to close the airports. And proudly, I say, is the first one in most of Latin America to open the international airports back to normal function. This is the most striking figure that I want to share with you. These are the daily deaths that occurred between April and July in Guayaquil. This spike showed that in one day, in one single day, there were 704 deaths in the city. And amazingly, after the end of April, we have controlled, as can be seen in the bottom right-hand side of the figure, how we have controlled these daily deaths. This is the current situation as September 22nd, and we have 102,000 recovered patients, close to 20,000 hospital discharges, 126,000 confirmed cases, and discarded cases, close to 200,000. We have conducted 389,000 PCR tests, and this is something that I would like to take a second or two to explain. We have, from patients with confirmed cases, 7,301 confirmed cases have died. But we have increased since September 7th also probable cases. This is a way to explain better what is going on in Ecuador without hiding the deaths. What is the age and sex distribution in national data? You can see that is slightly higher among men, and 60%, close to 60% are younger people between 20 to 49 years old. Very few are less than 4 years old. This map also shows the community cases by province. We have Pichincha, where Quito is located. We have Guayas, where Guayaquil is located. And as far as September the 22nd. And I want to also share with you that this kind of data, as well as these deaths per 100,000 population by province, are very useful for the local governments or the municipalities to take actions, public health containment, and so on. This tendency, this curve, this trend shows the deaths in Ecuador by date of death. Again, these are only COVID-19 cases that have been shown to have a positive test. And as you can see, and that's why the numbers are slightly lower than what I shared with you before, but also how we have able to contain the curve. And this is the last day of September the 22nd. Another way to see how are we taking care of the pandemic is to see the effective reproduction number, RO or RO, or also it's called the RE in Spanish, but it's the way that people can transmit the disease. I have chosen few of the provinces of Ecuador, those that were highly affected, and as you can see here, for example, let's say one is Manabí here, I'm sorry, Azuay here, where Cuenca is located, and it was as high as 4 in the very first, in the week of April, March to April, and then it is slightly coming down. This kind of more curves going up, we're going to see from now and on. But it is important also to notice the tendency to slow down these contagious, the contagious of the reproductive number. Also, this is an extraordinary graph that shows the comparison between, in the same months, between March and June, and in the previous years, 2015, 2016, 17, and so on, and 2020. See, here are all deaths, close to 20,000 deaths in this brief period, and that corresponds mainly to Guayaquil and Babahoyo, the two cities that I mentioned before. But after that, later on, how we have been able to control this is also important to notice. These are the extra deaths that occurred in Ecuador during this period of time. Proudly, this is the cumulative confirmed COVID-19 deaths per million people. And as we can see here, is Ecuador, a very flat line, and as compared to other countries in the region. Purposely, I put September 5th because, as I mentioned before, we changed the data and added in September the 7th also probable cases, not only the confirmed ones. What is the impact of the health sector? First of all, disease in the health professionals that took care of them. Increase in deaths by the coronavirus, as you can imagine. I showed to you 20,000 in a very brief period of time. Drastic reduction in usual attention. Substantial reduction in health promotion and disease prevention that we should be focusing on without the pandemic. Increase in referral of patients on public health network to private health network, and vice versa. This is important. For the first time, the public health sector was admitting patients from the private sector to our public health sector. Going on, the increase in infrastructure and equipment. I will talk a little bit more on detail on that. Increasing the capacity of public laboratories, the technology updates on pre-response systems, and the increasing in hospital emergency care. What was the strategy that we implemented? First of all, and most important, is strengthening the primary health sector. We're at the community level. Expansion of the hospital capacity, active search of COVID-19 cases, in an investment of $219 million for the health sector, devoted exclusively for the pandemic, and telemedicine training for health personnel. We have a shortage of personnel in terms of intensivists, pneumologists, and everything. And now we have primary health physicians taking care of COVID patients. Let's go one by one. Strengthening the primary health sector. We enable all these medical consultancies, 353, more than 800,000 attentions to vulnerable and priority patients, more than 800 external consultations, 345,000 emergency care for respiratory disease only during this period of the pandemic. Secondly, the increase of hospital capacity. 142 hospitals now take care of COVID-19 patients. 52,000 health professionals work only for the Ministry of Health. And we have contracted more than 2,000 health professionals for the emergency services along during the pandemic. Also, this shows the increase of beds. 1,117 beds only for hospitalization and 328 for intensive care units. This is an increase of more than twice beds and 2.5 to 3 points more intensive care units. The third point is the community surveillance that we use as the strategy. Active surveillance. We went after the cases, and we did that in order to provide early detection of the cases, isolation in cases and management of COVID-19, but in collaboration with the community. The preparation of health services, the improvement of health services capacity in all the small, tiny outpatient clinics all over the country. Communication and multi-sectorial coordination. That is very important because we incorporated all community servers, community leaders, and introduced several other plans to engage the community as part of their responsibility to contain the surveillance. And of course, we we also conducted a follow-up of the contacts of patients that were deceased. We did a lot in terms of identification of vulnerable populations, strengthening the Médico del Barrio strategy that was a big push for that. Households in poverty and extreme poverty, senior citizens, children with disabilities. We paid a lot of attention to indigenous populations, Afro-Ecuadorian, Montubio, and other minority children and adolescents, and persons of productive age who became unemployed, unfortunately, or informally employed. Children, youth, and women victims of domestic violence. In the fourth strategy was the diagnostic tests. We did not conduct massive testing. What we did is limited because of several reasons. One is the access to the RT-PCR test and also tests for antigens and antibodies. What we did do is the smart sectorization, as this map shows. We obtained probabilistic samples and conducted every test had a health survey and a georeferentiation, as you can see in the graph here. This is an example of the probabilistic sample. Now, in Quito, we know that 22%, one of every 5 individuals, 18 and older, has had the disease and has developed antibodies, approximately 370,000 people. Lessons learned, joint work. We need to work more, and we need to work with the city halls, open these spaces, private companies, the private sector, the general community. The primary health activation system, that I don't have words to repeat that once, again and again. Telemedicine, we trained staff personnel for 38 hospitals, and probabilistic samples instead of massive conduction of testing. And the international cooperation, which is essential. We just came from Charité in Berlin, and this person that is behind me, Christian Drosner, is one of the patients who discovered SARS-1. We have a strong correlation with them. What are the next steps? We want to move on and doing what is the up-to-date surveillance systems, genomic surveillance. We have detected and characterized certain viruses specific for Ecuador in collaboration with Germany. This is the multiple introductions of SARS-CoV-2 in Latin America, and these are 3 of the 4 viruses that are specific that have mutated in Ecuador. Why is so important to do this? It's important for the development of vaccines, because we want those viruses to be part of the vaccine, and also because of diagnostic tests. Diagnostic tests during the very first 5 or 6 days of when the person has been exposed to a case, and we don't know if the patient has an active virus or not. So, and very timely and diagnostic test is essential, and that's what we are working on with international collaboration. Allow me to finish my presentation. This is the last slide with a thought. This pandemic is a health, an economic, and more than anything, a social pandemic. It should not be solved inside the hospital. We cannot do that. We must control at the community level and work with the community in order to have a co-responsibility in order to stop this disease. Thank you so much for your attention.
Mr. Minister, thank you very much for that outstanding presentation. Really, really good, and provides confidence, I think, to those of us who have seen what's going on across the region, that you and your team are really on top of the situation to the extent possible. So congratulations, thank you, and we really appreciate that presentation. We have about 15 minutes for interaction with folks on the line, and we have several questions. I'm not going to take them necessarily in the order in which they came in, because several of them are similar in nature. So we're going to jump around a little bit, but let's get going with our first question, which is going to be, hold on just a second. I had it here and I lost it. Here we go. It's going to be from Erica Pagani. Erica, I think you're already on the camera. So go ahead and ask your questions, please unmute your line. Identify yourself for the minister and the floor is yours.
Hi, Minister. Hi, Ambassador Baki. You were showing great information, the RO, and as you probably know, I think all of us are discussing at this time, going back to work, going back to office, going back to field. I just wonder if, how can we get that level of detailed information so we can make the appropriate decisions and to protect our colleagues and collaborate with the community protection, as the minister was saying. We are at this moment evaluating the go back of our colleagues, and it would be very good to have this level of this granularity of information. I don't know if they are available.
Yes, Erica, thanks for the question. They are available. I think that we can provide you a lot of how do I say, some suggestions in order to manage. Every institution needs to manage individually.
Of course.
The access and the return. And because in every institution, the number of people that might continue to do teleworking or distant working needs to be assessed. But yes, the RO or the rate of contagious disease can be provided. However, this is done actually by an external source. We do not provide that, and we do it in terms of the general provinces and also at the national level. But we will be more than happy to provide you with suggestions for the returning at work, as we did in the airports, as we're planning to do with the schools. If you provide order, structure, distance, and you conduct piloting study and do it in a smart way locally, I think it has to be done in a successful way. That this is extremely important because and that's our experience, as I said, in the airports and in some of the pilot schools that we have conducted, and in the returning of the industry, for example, in the agro industry, pharmacies, supermarkets, and everything. I have proud to say, let me take this opportunity to say that I was surprised in my recent visit to Europe that the Ecuadorians were more formally and disciplined than the Germans, and that was a surprise. We had 18,000 people protesting in Berlin before we arrived on Sunday. That was a Saturday, against the measures. You don't see that here. We have 99.9% of people in the whole country in Ecuador with masks. We need to work on other measures, of course, but that's it. Thanks, Eric. I'm taking too long.
Thank you.
To answer.
Those are precisely the questions that are facing all of us, not just Ecuador. So, Erica, I wanted to start with your question because it's a universal question for each one of us. Yeah, indeed. So well done. Thank you for that. We're going to go to Nelson Baldeón. Thank you for that. We're going to go to Nelson Baldeón from
Yes, Eric.
Schlumberger.
Good morning.
Nelson,
Good morning with everybody. Minister, first of all, I want to congratulate for all your efforts and assume that position in very tough times. And the questions specifically is, we are in the oil sector. We are worried about the provinces of Sucumbíos and Orellana. Which is the measures that you are taking with the ministry to try to avoid the infections in that area and try to keep the oil production stable?
Sorry, Nelson, could you repeat a little bit louder? The speaker, I couldn't hear the last part of your question.
Okay, the thing is that we are following very closely the infections in the areas of Orellana and Sucumbíos, where is the oil fields. And we want to know about the measures that you are taking with the ministry to try to keep safe that the population and the oil workers to try to avoid infections and try for us to keep safe the oil production in that areas.
Okay, no, so I think, again, what I described during my presentation, it's essential to have the participation of the community. The individuals that live in Orellana, Sucumbíos, need to be part and be co-responsible with that, with the measures. We don't have any new things to share than what occurred and that was implemented in the 14th century, 673 years ago, during the Black Death, or in Spanish, La Plaga Negra. 670, we implemented the same measures: distancing, masks, and probably stay at home. We haven't improved that. And if we do not have an international setting as this one in order to discuss things, we won't progress. And it will pass 673 more years, and we will recommend to the general population the same thing. It's very sad. In Orellana, in Sucumbíos, we're working with the communities, with the local community, with the national communities, translating, for example, all these measures, trying to reach them in a way that they can, again, be responsible for their actions, and also improving several of the health centers there, particularly in Orellana. So we have trained the personnel, and we have expanded the intensive care unit beds capacity in that sector. So again, we also have a plan with Petro Ecuador and Petro Amazonas in order to improve measures and to enhance the active surveillance, meaning that the location of active cases and also the contacting the relatives or people that live with them. So we do have a plan on that, and I will be more than happy to hear your experiences and suggestions that you have in particular for that population.
Thank you, dear Minister, for your kind explanation. That just from your knowledge, we are the biggest oil service company in the world. We have our priorities is the safety of the people. In that way, if we can contact directly with the ministry, with the person that you assigned, it will be a pleasure to follow all these your kindly comments and try to work together with you, with our people. We have almost 2,000 people in the fields, and it's a pleasure to try to save all of them in coordination with your ministry.
The tension between the economy and the healthcare needs of the population is fundamental to what all of us are facing. And our next question from Carlos Albuja is going to ask that question. Carlos, we'll go to you, and then after you, we'll go to Stephen Arizaga and Felicia now. And I think that will probably be our roster in the time that we have available. So Carlos, to you, please. Carlos, are you with us? Well, in case not, Mr. Minister, let me ask the question that he had posed, because it is a fundamental one. The question is, to the extent there is a second wave of cases, does the government have contingency plans to shut down the economy again or take steps on the economic side? Perhaps that's a little bit out of your mandate. So if you have a comment on that, please feel free. If you don't, that's okay too. But that's the nature of the question, the tension between the economic side and the healthcare side.
No, thank you, Eric, and thanks, Carlos, for that question. You cannot solely think in this pandemic as a health problem again. it is an economic, a financial problem, and it's most of everything is a social problem. So yes, many more waves will come, but the key point is that these waves need to be contained at the primary health sector level. And to do that, we need to improve our communication with the surveillance, with the community, and things that we active surveillance and things that we have already discussed. But also, it is important to prioritize which are the sectors that need more care in terms of, for example, as I said, agricultural, everything that deals with food chain and everything to sustain that. So we need to put a lot of emphasis on that. Supermarkets, pharmacies, the health personnel needs to be active. And to do that, in order to activate, there must be a balance between the activation of the economic sector, prioritizing, as I said, those sectors, and also measuring the risk of this interaction. If we do in a ordered, structured way, I think that we can minimize. We cannot avoid more waves, but we can minimize the sanitary structure and the investment that we have done in the sanitary sector, in the health sector. It is extremely important. If the waves, as we have done in Ecuador since June, perhaps May, in the whole system, in the whole country, if we contain at the primary level, I think that new waves may appear, but we can control them, we can contain them. What we don't want is the spike that I presented as, I think that's slide number 5, this extraordinary spike that occurred, unfortunately, in Guayaquil. And that was a lesson that we learned very carefully and say, no, this cannot be happening again.
Thank you. Stephen, to you, Stephen Arizaga.
Thank you very much, Eric. Minister Zevallos, first of all, thank you very much for your actions and leadership during this pandemic. Moving into the question, a few months ago, you suggested that up to 60% of Ecuadorians would probably become infected with COVID-19. But zooming into Quito today, we see that the sample suggests around 22% have had the virus, judging by the presence of antibodies. Does this mean that we are far away from the peak in the capital city, or has the projected percentage of infected people happily decreased?
Thank you, Stephen. That is a very important, and thanks for thanking me. It has been my pleasure. It has been hard, but truly, I am proud of committed my time and my effort to try to contain this pandemic. Yes, I did say that based on the very first data that we had from China. They projected that in 120 days, the 60% of the population will be exposed to the virus, exposed to the virus, and perhaps also develop some immunity for that. But that was taken into account without thinking that we would be able to contain that, to improve the primary health sector, and to divide, for example, in every single center, two flows of patients, one for infectious diseases, respiratory disease, and the usual care. And what we have done is try to spread that 60% in a wider timeline. Later, we spread that so that we have a very limited sanitary health system capacity. We have a very limited in terms of personnel, in terms of infrastructure, in terms of ventilators, in terms of medicines, and so on. So if we contain that and spread that over time, I think that, and that strategy that we use is the useful one. Yes, Quito is about 22%, as I showed you, in a very carefully designed probabilistic sample. But Guayaquil probably is 33%, And we have data from Esmeraldas, the province in the northern coastal part of Ecuador, that is around 43%. So it changes from place to place. Populations react differently. I hope that we don't reach that 60% because the death toll, in order to have that level of confirmed cases, is too high and too costly in terms of deaths. So hopefully we will continue to contain and have these small waves that spread all over time until the vaccine arrives. And probably we will have that, perhaps the first doses will come early in next year, the first semester of next year, hopefully. But I'm a skeptic about that. And we can discuss further that.
Minister, thank you. We are at time. I think hopefully we can squeeze in one additional question, but just to alert you that we have several questions from people who are asking to make sure, please, that the ministry is aware that the private sector is very interested in working together with you and your team to find solutions, to lend their expertise, to add value to the efforts that you are doing, and to be a real partner in this effort to the extent it's convenient for you and your team. But just, there are several questions like that, so it is a priority, and I wanted to raise that with you. Let's go to our final question. I'm sorry, we just don't have additional time, but Felicia, to you.
Thank you so much, Eric. Señor Ministro, Dr. Zevallos, Embajadora, thank you so much for this presentation. On behalf of the University of Miami, and I speak for our Institute for Advanced Study of the Americas, but also President Julio Frank, who has been in a position of having to, the difficult position of being minister as well, but not in this level of pandemic. Estamos a sus órdenes. I'm sure we'll discuss that, and I want to be able to discuss that later. I had a couple of questions more from my position as a global health researcher and some of the research that we're doing. But just before I do that, to truly have a moment to congratulate you. I've seen several ministers present on this topic and on others, and this is one of the most professional and serious from an academic point of view, as well as a public health policy point of view, presentations I have ever seen, and I've seen many. So thank you very much, and I mean that not only from the political and policy point of view, but also as someone who works in the field. There were three questions, but I know we won't have time for all three. I'll throw them out, thinking that perhaps one might be possible. The first is around this very high rate of mask use. We've seen the Facebook data. I've been reviewing that, the data that the Institute for Health Metrics and Evaluation are also using. And those rates across Latin America are so high. Even when I've been analyzing some of the surveys, like the ones that Cesar Victor has for Brazil, they're almost unbelievably high. And we've been trying to understand that better. The second is, how do you feel about the use of the indicator of the positivity rate? I know it's a double-edged sword, but has been helping us primarily in other countries to think about whether or not testing is being done appropriately, as well as to see how to some extent, how the virus is progressing. And then finally, I might talk about this later, is we've been very interested across the region in the subnational policy response, particularly in countries where there's been a failed national policy response, which is not the case in Ecuador. But I'm curious as to whether or not you've got some variance in the subnational policy. And thank you again. Mil gracias.
Oh, gracias, Felicia. I missed in part Miami also, that I was at FIU and I worked with Dr. Sacco and Julio Frank in some initiatives in the neurological, more boring topics than them.
Come to Miami anytime. Why go so far as Germany? Ministro, aquí le esperamos.
Yeah, okay. I have a son living in Miami, also studying medicine, so there are many ties and good memories. But Eric, allow me please to share with you. Yeah, the solution for this pandemic cannot be done from the government point of view solely. We need academia. we need to work with the private sector. We must work with the private sector. And in Ecuador, we have had an extraordinary experience with several fideicomisos that really work with a generosity never seen before. And I think that we should continue learning, and I am absolutely open to this, not only to the community at the community level, but also the private sector. The private sector must give and provide suggestions, and we must work together in order to, as early as possible, exit this pandemic. And Felicia, going back to your question, yes, that positivity with testing and rate must be included in all the decisions. For the central government point of view, we provide that at the local level as much information as possible, because they know better than anybody in their populations. I'm talking about small municipalities or governments at the local level. They know their population, they know the limits, the strengths, and we must work with them in order to improve and strengthen the collaboration. And provide the indicators in order for them, jointly with us, with the central government, to make the decisions. So yeah, the positivity rate is one of them. The other is the importance of continue testing the population, but in an order, in an intelligent way. That's why we, in every single step, what we do at the community level is to have a health survey, a small one, but a health survey that can be used for us. And the second one is the test itself. Which test? PCR, mainly. But in Quito, the 22%, for example, was done with not PCRs, but done with antibodies, because we want to see what is the seroprevalence of the population. And third, the georeferentiation. We were able to locate the houses of every single person that was contagious or had a positive PCR, saving all the confidentiality. They were done only by the army, managed by the army, and everything, and to solve this part of that very sensitive part of the confidentiality. But if you add the health survey, the testing itself, and the georeferentiation, you can locate the cases and act with the municipalities and the local governments on that regard. I would be more than happy, Felicia, to have another conversation and to answer more of your concerns about that, because I think that's the way to do it. This forum serves for that. So you have my contact. Let's talk about it.
Be honored. And there's some research I want to tell you about and how we might possibly do some collaboration, but estamos a sus órdenes.
Well, unfortunately, we are beyond the allotted time for our public program, so we're going to have to call a close to it. I know that there is a lot more interest, Minister, to continue the collaboration with you. So bearing in mind what you just said, perhaps we can get you back to the Council of the Americas at some point for an update. But when the ambassador introduced you, she said that you were essentially a national treasure of Ecuador. And I think after this performance and your presentation today, I think I would concur with that, and probably everybody online would as well. I want to thank our sponsors again for the series support. I want to thank Felicia for her leadership of the initiative, along with Hugo Villegas. I want to thank Susan Siegel, the president and CEO, who is on the line as well. Madam Ambassador, we look forward to hosting the reception for you next week. I could go on and on, but we don't have the time. Mr. Minister, thank you again, and this concludes the public portion of our program.